Step by step, we'll light the way.
Well, hello, Dr. Lemmo. It's good to see you again.
Yeah, it's a pleasure, James.
Wonderful, and thanks for meeting with me here today. And the you we talked about circulating tumor cells, and you said and testing that we were going to talk about. I find that you're very interesting. Could you tell us how that works and the studies behind that?
Yeah, so the concept, so what circulating tumor cells are, and the other terms being used is circulating tumor DNA, because
Okay,
there's actually cancer cells that are found floating in your blood. And it doesn't mean like a cancer quote is metastatic when you find them. Um, and they're kind of circulating around, and it's not new. They've been in, like, I've been around them now for over, gosh, like 15 years or so, or greater. But now what's happened is the concept of these circulating tumor cells have become like very much in the mainstream category. And what they're being used for is many ways. So I don't know if you ever heard the term liquid biopsy
I
before.
I have, yes.
Yeah, so we know, like, there's tissue biopsies, right? And like from a lymph node or tumors or whatever, bone marrow. But now there's also, like, if there's these tumor cells that are found floating in your blood, then obviously what's popped up, hey, could we test those?
Right.
And you're getting things in real time, because as we know, cancers could change and mutate. And so the applications of circulating tumor cells are manyfold. So I'll tell you, one of the ways is sometimes they're used to track people, right? Where and so, say for example, someone has been cancer free and there's no visible tumor markers are, say, normal, blood tests look good. And so you're looking at really, really fine-tuned levels of finding these cells, like these individual cells. And so for example, like when you're looking at like when you're, say, doing a scan, and they have to be a certain size, but for a scan to detect them, right? They got to
Okay.
be a certain size. Versus these, we're looking at cells. So by the time you're picking up like a spot on a scan, there's like billions of cells in there, that have to
Right.
clump together for you to find them.
Okay.
So now they're talking about, hey, if these little cells are like, we're looking at individual cells, maybe those things could detect things earlier than, say, looking at a scan. And
Okay. Good. Good.
so they've been used that way. And here's the thing, what they've also found with them. Say you had like a tumor, you cut it out, everything looks cancer free, but then you start looking for these fragments of these tumor cells in the blood. If you don't find them, it's a good thing. That means that the likelihood of this cancer coming back, is like is a lot lower.
Right. Good. Good.
But say somebody else, where you run it, your cancer, you remove the tumor, there's no obvious cancer signs, there's scans are clear, but if you find fragments of these cancer cells, guess what? That means there's a higher risk of the cancer coming back, and
Okay.
there could be something even hidden there. And so it's being used for that as well. And so, and this is where it's kind of going. So there was like a new paper that was published in colorectal cancers, where they were looking at patients where they removed the tumor, and then they found like a chunk of them that, yeah, they had this circulating tumor cells that they could detect, or circulating tumor DNA fragments of the cancer cells. And we know those are higher risk. And guess what they were given patients? The anti-inflammatory drug Celebrex.
Okay.
And so what people don't know is that sometimes anti-inflammatories could be like a gentle chemo. And
Really?
yeah,
I didn't know that.
yeah. So that whole anti-inflammatory, anti-cancer connection. Anyways, in the patients where they found those fragments of this of the cancer cells in the blood, and they were on Celebrex. Guess what happened? Their survival was better.
Oh, excellent. Excellent.
Yeah, so isn't that cool? So here we see like a personalized use of like running these tests, and which could be helpful for like, maybe taking some anti-inflammatories, which could calm down the environment, the inflammatory environment, or who knows how else it's working. So
Right.
that should have got like tons of press and news, and that didn't. That was published this year of 2026. So
This is a big deal.
I think so, and that was kind of one of the reasons I wanted to talk to you about this subject, right? It's like, because it's like there's so many other things that people are talking about. I go, here's something that it's like anti-inflammatory, and there's a group that's higher risk of reoccurrence that,
Right.
conventionally we don't know what to do with them, and here's this paper to suggest, hey, that group that was given the anti-inflammatory medication Celebrex, it worked like a chemo to kind of calm things down. So that's, and obviously in our world, like we've been around this world, like we've been using, because we were around it before there was like even, it was more mainstream. We were using our tools, like, hey, what would vitamin C IV do in cases where we
Right.
find these things elevated, and or other things, quercetin, curcumin, anti-inflammatory protocols, whatever, right? All kinds of things. So there's this universe that you could do stuff with, okay? And then there's the idea of the liquid biopsy, where all what you're doing is you're taking a simple blood test, and there's a lot of laboratories do this, including conventionally, because some kinds of cases it's hard to biopsy. There's risks with biopsy. There's bleeding risk. And so, like, say in forms of lung cancer, that's become like an FDA approved method.
Okay.
And then they're like running like genetic profiles to maybe see what chemo drugs or not, or targeted drugs could be used, right, etc. But also there's some laboratories that are not only looking at stuff like that, but they're looking at, hey, could vitamin C kill these cancer cells? Could mistletoe do something to these cancer cells? Could
Terrific.
curcumin do something? Could ivermectin or fenbendazole, whatever, Celebrex, like you name it. It's like it
Right.
could look at all those things, right? And so it's, yeah, the laboratories are considered experimental, but still like interesting. So we've been around some of these labs like for over 10 years. And they largely have been European, right? That have been looking at this kind of stuff, and then even like there's one from India. But, anyways, so this is where this world can be quite more personalized,
Right.
and trying to home in sometimes some treatment options. So for example, like, we know there's like that subject, for example, like that I mentioned, those anti-parasite drugs that are pretty popular these days. And so we've had many patients where we've ran these laboratory testing looking at these circulating tumor cells. They found them, and guess what? Like, a lot of the time, those cells show like, yeah, it doesn't look like those drugs do anything.
Oh, good. Okay.
So, but these other ones, boy, like they sure looks like they're much more promising.
Right.
And so you can use it in all these kinds of interesting ways, and so that sometimes you can home in things. So we've had patients, for example, where it seems like their whole life story dealing with cancer, say someone who had an advanced disease, and it looks like this drug worked, this drug didn't work, this natural stuff didn't look like it worked well, this stuff did, and that was exactly what some of these tests showed. Like,
Wow.
and so some patients have been mad. They're why isn't this talked about? Like, why isn't this
Correct.
available? And so I always tell people, I say it's not the word of God, so to speak, but it's a guide.
Correct.
And so that's how I view them, as like as a guide. And So, and there's definitely groups of patients we've seen that, could be quite helpful to spend some of the money to run these tests, and you can look at conventional drugs and
Right.
conventional approaches. And for those who are not interested in that world, like these profiles can just look at the other side, and then you just go from there.
You would have thought that this big of a deal would have made some headlines. I this could save people's lives.
It could, right? And it could help to minimize sometimes the guesswork too, right? Like
Correct.
it's where that sometimes cases could be complex and you're trying to figure things out. Yeah, we have experience that obviously guides our practice and sometimes modalities and tools, which I think is important too. You see outcomes, but yeah, and I think what's unfortunate in one way is that like these tests, as I said, are now available in the mainstream, but they more focus on conventional things, right?
Okay.
So it's more looking at, genetic targets. If you have these mutations, maybe these drugs could work better, or, blah, blah, blah. And again, but in terms of looking at beyond that, it's not there. They're just focused on that world. And so what I like about some other labs is they're not polarized. They're like, okay,
Okay.
we might look at things a little bit differently, but like a lot of people are interested in these natural medicines, these repurposed or off-label
Right.
medications, and so we're like wanting to look at those too. And I think that's why we can find them helpful in patients as well.
A
And
patient
just
just wants their life and their health back. That's what they want.
yeah, and I'll tell you like a story that just came to mind. So I had there was this one patient that comes to mind. He was dealing with this advanced form of sarcoma. It's a more rare subversion that's like, it's one of those like, 1 in a million kind of subversions. And they were, going through treatment off and on, and they're doing some naturopathic, integrative, approaches as well. Eventually, like this test was ran, and some interesting things came out of it. Yeah, vitamin C looked like it worked well,
Oh,
and
good.
a bunch of other things. But there was also a couple other conventional drugs that are not commonly used for this kind of cancer that popped up as well. And so I kind of, when I looked at it all, I said, hey, listen, I think these kind of drugs could be given by your oncology team, and I think it's in a way that that could be considered for them. And guess what ended up happening? They ended up saying, okay, we'll do
Good.
that. And that works for us, and actually the treatment worked.
Oh,
you know,
great.
and,
Great.
so
Perfect outcome.
that came from that test, right? Like
Wow.
it looked at some of the conventional, and then it obviously had some other stuff and on the natural medicine, integrative medicine side, and that's where, again, would all oncologists do that? Probably not. But the family was they were quite pushing too. They were like, hey, like, what do we got to lose here? And these things showed up, and we're wanting to do what we can here, and so there you go.
Well, that's a good example of the oncologist and you as the NMD, that you're working together to solve that problem.
Yeah. So
They didn't
so
reach
that's
out to you necessarily, but you looked at
oh
that same right. But you looked at that information, but had that patient not gotten you involved, somebody outside the a plan of care involved, those options wouldn't have been looked at.
That's correct, and that was a great value of having a collaborative team. The test provided us some insights that
Right.
that not even the standard oncology team was thinking about or would administer, and then yeah, created in a framework that kind of made sense. So that's where obviously skill sets come in, experience comes in to try to to create an effective program, right? And so, yeah, and that's just like one example, right? And there's been many others, but that's just one that I guess just popped in my mind.
That's a good story. The
Yeah,
because ultimately what you want is you want to get your health back, and there's so many other options and reasons to get um, your another opinion on this and getting a natural holistic point of view, because there's options that world is looking at that the oncology team didn't consider.
that's right. Yeah, and that's what I mean. So that's what can happen and that's again one of these interesting uh, values of like doing these types of testing, right? So again, the circulating tumor cells or circulating tumor DNA. So imagine you can be using them to say to track people. You could be using them to like, hey, what's your risk of the cancer potentially from coming back or
Right.
not? And then you have this liquid biopsy that if they can find them, you could run creative tests with them, and so and that's why I think the mainstream has been quite moving forward in this direction. And there are laboratories like in the United States that are looking at the standard conventional stuff, and so, but I think it's I'm even finding sometimes, though, like here in Canada, that patients don't even know about it still, or they're not talked about it, and I think like part of it, the difference sometimes with the Canadian healthcare system is that they normally tell you things that government pays for, right?
Right.
And if they can't, they don't tell you about it, and that's I think that's wrong. But so and but again, these some of these out of the box tests that are not, say, standard in the U.S., I find that the standard oncology community doesn't tell them about those labs and
Right.
those
So
and
those tests that you're talking about having done, that's something that would come up in a consult with you, and then you would order those tests. Is that correct?
Yeah, you totally could, right?
Okay.
And all what it involves is like because you're looking at blood tests, it's like a simple blood draw, like it's not requiring like tissue sample
Right.
or biopsy sample. So it's just like going to a lab. You take the blood and you prepare it, and you fire them off, right? So these lot of these creative labs are in Europe, and so that we deal with, and so you got to ship them out there fast, and then they kind of take care of the rest. So and other integrative doctors, oncology based, are also using these labs as well. They're not uncommon, but I think the general public, I would say it's more uncommon for them.
Yeah.
And
How long does it normally take to get results back after that blood draw?
it's like you can get results within 2 weeks.
Okay. Okay. So
Yeah.
fairly timely.
Yeah. Yeah, you get them with 2 weeks, and then you get the results, and then we send them to patients, usually first, and then and then we kind of sit back with them and review it all,
Right.
and then we put in our 2 cents into them as well, like because obviously we have experience in these areas, and so we can provide in like some insights and things and patterns. But I find that like they even could even profile like is like the cancer cells sensitive to, say, insulin, so it looks at
Oh,
those profiles. It looks at, is it sensitive to like anti-inflammatory markers like COX-2 and LOX-2, and like it just looks at all kinds of things. And so sometimes when you're looking for options for people, then you're like, well, your cancer's cells had these characteristics, so it'd be like, oh, like maybe we could maybe we could, like, okay, if there's some other approaches that maybe didn't get tested for, and then
right.
maybe it'd be like, okay, I think these kinds of things could be useful for your case based on the markers that we saw on the testing, and so and you sometimes you find people different eyes looking at the results. They could be like,
Correct.
yeah, okay, I think this could be useful for you too, and this too, and so it does broaden the box, in terms of creative insights, and especially when cases need that more, it comes in handy.
Is that how a liquid biopsy is done? Is just a blood draw?
That's it.
Wow, that's not
Yeah.
invasive.
No,
That's not invasive.
no, and that's why it deserves attention, right?
Correct.
It's just
Correct.
it's really more about the having the kit, the right kit with the laboratory needs and collecting it, and then make sure it's all packaged right, and then firing them off, and
Wow.
yeah, that's usually what it is. It's those steps, and that obviously and away you go, right? And so most laboratories, they're happy to have your business, and so they usually send people kits and all the paperwork that's
Right.
required, and then away you go, and
But
so
and I'm here in Arizona. There's a lab or a doctor on just about every corner out here. So there
right.
there. I told somebody, I go, it's like a southern term is that you can hardly throw a rock around here without hitting a doctor, lab, or a hospital. They're in abundance. But the yeah, this shouldn't be any fear of getting a liquid biopsy, and these that
Yeah. Yeah, and
it's a blood
sometimes
draw.
yeah, and sometimes patients, what they could do is they can get like, kits delivered to their homes or to whatever facility, and then, just follow the instructions and fire things off, right? And I think there needs there needs to be, in my opinion, more labs looking at these creative testing, looking at repurposed meds, natural medicines, like in the US more
Right.
and in Canada. But, to my knowledge, I haven't really seen that. And, there's probably room there and doorways for doing that as well.
Correct. Correct. So yeah, I don't know why an oncologist wouldn't, other
Yeah.
than maybe it didn't occur to them. But this is if you're looking at a standard set, standard toolbox, and you're going, this is what I'm working with, where you get your NMD involved, where there's other options that they're used to working with. So the with this, you talk about like after surgery. This sounds like some testing that you could do prior to and after surgery.
That's correct. Yeah. Like I remember one of these tests that one of the labs that we did, because we tracked some pretty educated patients, right?
Hmm.
And so, progressive, and they wanted to know, before I do this surgery, are they detecting these cancer fragments? And
Correct.
sure enough, they did. And then after the surgery was done, they cut it off. Boom, you know, it went to undetectable range.
Okay.
And this patient, tumor markers didn't show anything, any blood tests didn't show anything. It was just like, yeah, the scans did. You could you could feel it. It was like a breast cancer. And I said, well, well, the good news is that because those cells now are undetectable, right? That means like it gives greater confidence of the risk of this coming back is much lower.
Right.
So that's where you could use them creatively. And then obviously some, they tend to do them after surgery. They just want to know if there's any remnants or anything
Correct.
left. And away you go. So yeah, they call that term MRD, minimal residual disease. It's called MRD
Okay.
is the medical term. And you want you want MRD to be negative, right? Like nothing,
Right.
nothing you could find. So anyways, yeah, and again, as I said, these tests are not always the word of God, but they're a guide, and they're quite interesting. And so that's why it's very much on the conventional radar. I would say in like cancer, like colorectal cancers, for example, like that group, it's getting more mainstream by the second.
Okay. Good. Good.
And so others, everyone's still debating, like, is this, ready for like mass, use or what? But anyways, I've definitely, because we deal with individuals, and more that, that personalized individual
Right.
approaches. That, yeah, you attract people that sometimes some people know the answers what they're looking for, and we just
Correct.
help guide them in that.
It,
So we've definitely seen their value. Like, we've seen patients, for example, where say they have like a hormone positive breast cancer history. They were like, say they're years out, and then for example, they ran some of these tests to track them, and their markers are going up, like of those
okay.
circulating tumor cells. And yet, but again, no scan, you can't see anything. Blood tests are normal, they feel great. And then you ask her, like, okay, well, like, what have you been doing? Well, I stopped doing like my turmeric, I stopped doing this, I stopped doing that,
Right.
or whatever.
Right.
And then all of a sudden, like, well, tell you what, like, once you get back on a certain program again, they're getting a bit lazy.
Right.
And then guess what happens? You run it again, bang.
Good.
You know? And this patient, it's probably been like 10 years, like cancer hasn't come back, right? So did it help them for helping with disease reoccurrence? If you ask me, I'd say yes.
Yes.
And so that's where, as I said, it could be used. I've also seen it used with some conventional drugs as well, I've seen some patients where they say they're on some hormone treatment, and then they got off that, got on another, and all of a sudden those numbers dropped again. And so it's this creative, use. And that's why I think not all oncologists are probably capable of doing that, or they just want to deal with that, or it's a bit considered experimental. But it's in our world. I think it's really exciting. It's really interesting.
Correct.
And you got to know how to use the tests, and then you just go for it.
Well, the fact that you could use that test after you've been, given a clean bill of health to make sure that things are on track is a great idea, because it's very easy to go. You stop exercising one day, and then one day leads to a month to a year, right? Or you stop taking those supplements or whatever, or that IV treatment, and then, but being able to have this testing to make sure that those things are on track, and it's a blood test.
Yeah, I think the counter argument has been historically is like, say if a test is positive, right? Or going up, and the standard oncologist, they're like, they don't know what to do with it, because all they have is like chemo and this and that. And so that's why sometimes they are, well, it's just going to create more fear or more anxiety, or we don't know what to do with it. But it's like, but I go, but wait a sec, maybe that could be you, but how about us? You know what I
Correct.
mean? How about others that have like a different set of toolboxes,
Correct.
and different tools and modalities, right? And so I think that's where that could come in too, right? Where it's like, well, we have tools too,
Right.
and maybe in your eyes are considered more experimental, but doesn't mean they can't help somebody.
Correct.
So I think that's, so it depends, I guess, how reductionistic oncology team members could be, and some patients, honestly, maybe ignorance is bliss for them, and so like, who am I to judge, right?
Right.
But but there's definitely the group that wants to be proactive, wants to know, they're wanting to, see what they could do, and
I can tell you, not knowing doesn't make it go away. So these are really good reasons to, even though if you have the oncology team, having a natural team on top of it working, so that these other tests and so forth, and tools that can be used to keep you healthy, that these are being brought to the forefront, so that you can have and these come up in consultations and conversations with the doctor.
Right.
So get even if you, when I've had conversations with patients and they go, well, thank God I no longer have any evidence of disease. I'm like, still, let's get the natural doctor involved. Looks like doctor, we're running close here on time. It's been a great conversation, and I look forward to speaking with you next week, and just great information in testing to get patients involved and keep them healthy.
Well, thank you, and appreciate the work you're doing.
Oh, wonderful. Thank you very much, Doctor. Appreciate you.
All the best.
Bye-bye.
I hope you enjoyed the video. If you're in the need of integrative and holistic treatments for you or your family member, please feel free to reach out to us at findhelpforcancer.com. We'll start with a simple conversation and help point you in the right direction. Happy to help.